So welcome everyone. Thank you so much for attending our webinar today and our next episode in our speaker series. Just a quick reminder to everyone that we are recording the session, and so the recording will be available to those of you that attend. And then at any time, please feel free to ask questions. You can enter your questions in the chat, and there's going to be plenty of time at the end for us to answer some of your questions as well. All right, so today we're going to be discussing how Baylor Scott & White hires nurses, permanent nurses in particular. My name is Iman Abuzaid. I'm an MD by background, and I'm the CEO and co-founder of Incredible Health, which is a hiring marketplace for permanent nurses. At Incredible Health, our marketplace flips the script. So hospitals and health systems apply to nurses instead of the other way around. And so hiring happens in 20 days or less instead of the 80-day national average. Joining us today, I'm pleased to welcome Lisa Kraska. Lisa is the VP of Talent at Baylor Scott & White. She has over 25 years of experience in improving recruitment outcomes, increasing the productivity of talent acquisition and talent acquisition teams, in developing talent, and in building employer brands as well. Thank you, Lisa, so much for being here with us today.
Thanks, Iman. I'm really pleased to be here. Thanks for having me.
All right, we did have Cindy Murray as a speaker as well, nursing leader at Baylor Scott & White, but she was not able to attend because she's out sick. But we've got Lisa, and Lisa will be representing Baylor Scott & White. So what we're going to be covering today is we're going to do a quick overview of the market, so we all understand the lay of the land of what's happening in the talent market today, particularly when it comes to permanent nursing and permanent nurse hiring. We're going to be covering a nurse hiring strategy where Lisa will be sharing a lot of her tips and strategies and tactics that she uses to be successful at Baylor Scott & White. We're going to be covering nurse career development, the topics of compensation, shift preferences and flexibility, as well as hiring process and the use of technology as well. All right, so I'll do a quick overview of where we are in the market today and what's happening with nurse hiring before we hand over to Lisa to share some of her strategies and tactics that her team uses to tackle some of these problems. So our demand for healthcare as a country keeps going up. It keeps increasing. Our population is aging. So there's big demographic changes happening in the US. And of course, pandemics don't help. They are demand shocks to the system. And our supply of healthcare workers has not kept up with that demand. As of 2018, healthcare became the biggest employment sector in the US by number of workers, and 1 in 8 Americans works in healthcare. Now, this problem that we're all tackling of supply and demand, it actually is getting worse. And every year it keeps getting more and more challenging. We're on track to be 1 million nurses short by 2023. The average annual acute care nurse turnover in the country today is at 21%. It is actually up 2% in the last 12 months. It used to be at 18%. Labor as a percentage of revenue also continues to increase. It's currently at 48% as the labor costs of health systems across the country do increase. And this is not just travel nurse labor or contract labor. It does include the permanent nurse labor too. Permanent nurses are also becoming more and more expensive over time. And then in addition, the days to fill or the time to hire a permanent and specialized nurse in the country today is sitting at an average of 82 days. Now, the pandemic has exacerbated many of these statistics as well, because it has created a demand shock on the system. All right, so before we dive into detail hiring, is curious, Lisa, if you could share with us how the pandemic specifically has affected nurse hiring at Baylor Scott & White.
Yeah, it's been a really interesting ride for us. Initially, at the start of the pandemic, we slowed down recruitment, not just for nursing, but all of our positions, and then pretty quickly rebounded and have accelerated our recruitment. We've had some record-breaking vacancy rates and openings for our system, and we really feel the pressure of this talent shortage, both for nurses and physicians that have been leaving bedside care. For us, we have 52 hospitals. 17 of them are magnet designated, 49,000 employees, 10,000 of them are nurses. And we surely, with the size of our organization, feel these market conditions quite smartly, and it's impacted how we hire talent today, Imran.
Okay. And so when we're talking about specifically how how the pandemic has impacted Baylor Scott and White, you mentioned staffing shortages that you're dealing with. There's also, it sounds like there's also increasing competition as well for the nurse talent.
That's right.
And then similar, like many other health systems, you're dealing with burnout and nurses leaving the profession too.
That's right. Our nurses are also heavily pursued by recruiters. There's a lot of outreach right now, and they're really tempted by the high dollar traveler roles. So we have to stay pretty competitive to retain our talent. So we've got the staffing shortages, a lot of recruiter outreach, and we know from sources like Indeed that there are 50% fewer applicants per opening in the healthcare space than there were pre-pandemic. So we really had to pause and look at the way that we attract and engage talent, both internally and externally.
Okay. All right, so let's dive into the topic of just executive strategy, right? Hiring at the end of the day, especially in a market like this, does start from the top. Mm-hmm. And we often hear from many HR executives and nursing executives that it can be challenging to have a harmonious relationship between those two leaders and those two groups. We know that you've achieved this very successfully at Baylor Scott and White, your collaboration with nursing. Would love to hear your thinking around the executive strategy when it comes to permanent nurse hiring.
Yeah, well, thank you for that question. You're absolutely right. I think this is one of our secrets to success here. And we're very blessed to have a strong collaborative relationship between HR and nursing. And we really feel that this is key for us to move forward and in every step throughout the pandemic. We have the support of our CNE, Janice Walker. She has not only an excellent grasp on all of the challenges that we're facing in this labor market and due to the pandemic, but she's really vested in how we approach recruiting talent and helping us remove any obstacles that we're facing that prevent us from going as fast as we can in securing talent. Janice also hired Cindy, who was supposed to be with us today. Cindy was a retired CNO, and she joined to act as a single point of contact with the nursing team and working with us on solving the challenges around hiring. Staffing is the top issue for most of our CNOs, and so Cindy's dedication and perspective has really accelerated our ability to respond to the conditions. We've had increased demand in positions. And when you pour that type of demand on our processes, we could start to feel them shake under the weight of it. And it really takes joint problem solving to figure out how to move faster and gain better results.
Okay, and so tactically speaking, how is it that the two teams work together?
Yeah, well, we have a true steering committee that is formed by a cross-functional team of leaders across our health system. And we leverage things like ongoing meetings. We have daily huddles with Cindy and review any places where we might stall out. We are very dependent on data. And we use that to identify any trouble spots where we have gaps, there are no candidates, or any potential backlogs of candidates. We're also exploring our talent pools. How do we leverage them to the fullest? And so if a nurse candidate isn't perfect for this role, we rapidly want to get them to the right position in our organization so we don't miss an opportunity to hire them. We rely on a lot of bi-directional communications with Cindy and the CNOs and our talent acquisition team so that we can pilot things. That might be different ways to interview talent, to form rapid hire models, and then we can focus on best practices and lessons learned really quickly. We have the advantage of a steering committee that was formed in 2019 that's just focused on nurse recruitment. It's co-chaired by Janice Walker and myself, and we've spent a lot of time just laying the groundwork. I think that really accelerated us throughout the pandemic. Some of the things that we tackled were streamlining requirements for positions instead of having variation in the types of requirements we have for a role across the system. Janice has done a really great job of setting standards so that we aren't artificially restricting the talent pool in any way. We've also done a lot to create transparency around internal applicants and facilitating movement with them based on their career interests, because we'd hate to lose someone due to not having the perception that they have a career opportunity in our organization. And then we also kicked off our Nursing Institute, and we leverage that in all things that we do in attracting talent. So really, I believe that having a steering committee or this partnership with Cindy has allowed us to have transparency aligned to the urgency and needs where we have the greatest need to focus and to remove any obstacles together.
Okay, so that's, I mean, you have a pretty robust strategy there between HR and nursing, and it's at the most senior levels. Just to summarize, it sounds like, you know, there's you're tackling the requirements for each role. So each, you know, nursing manager across the system cannot pick and choose, you know, and be as picky as they like, right?
Yeah.
There's some control over that, which is important, right? Especially given that there's 45 nursing specialties, right? And different requirement, and you have a whole range of locations, you know, with 52 facilities. Different facilities have different needs, but you know, some of those are valid and some of those are not, right? in terms of what they're looking for. Also, you have a very robust way of ensuring that talent doesn't get stuck, right? Like I know that you've implemented a rapid hiring model as well, and that was in collaboration with nursing. That wasn't just an HR only initiative. Is that correct?
That's right. That's absolutely right.
Okay. Great. So the next topic we wanted to go into, and by the way, just to everyone in the audience, please feel free to ask questions in the chat, and we'll address them at the end as well. Is career development and career opportunities for nursing. I mean, this has been critical not just for hiring, but I know we also know it drives retention at Baylor Scott & White. So when we are looking at incredible health data, and as nurses are signing up on our platform, we often ask, you know, why are you changing jobs? You know, why are you looking for a new job? And by far, the number one reason is I'm looking for career advancement. And, you know, and it's following that is I'm looking for a better work-life balance or different schedule. Following that is, hey, I'm relocating or I need to shorten my commute time. And the fourth reason, the least common reason actually, is I'm looking for higher pay. I think many HR and nursing executives make the incorrect assumption that pay is number one. It in fact is not. Career advancement and career opportunities is number one when we're looking at our data across 22 different states. So let's talk a little bit more about those three areas. Career opportunity. We are going to talk about career opportunities and then compensation and work-life balance as well. And curious, just from your perspective, Lisa, how your team is thinking about career opportunities and how you use that to attract candidates and hire great nurses at Baylor Scott & White.
What a great call out, Emma. I am so appreciative of your insights on, you know, why nurses consider making a change. And we've had our sights set for quite a while on knowing that if we want to attract great candidates who want to grow their careers, then we need to be a place where we're known for growing nurses' careers. So we really are walking the walk. We have a lot of pride in excellence and our training programs for nurses and nurse managers. We have, I think I mentioned before, the Nursing Institute. It has 4 key pillars. There's a Center for Nursing Leadership that's focused on advancing leadership skills in nurses. The Center for Nursing Professional Development and Practice. And this group is focused on creating better patient outcomes while advancing nursing skills, teaching patient-first, evidence-based approach to nursing. We have the Center for Nursing Research that gives nurses the opportunity to be a part of the latest innovative advances in nursing, including our Nursing Scholars Program. We have a Center for Clinical Excellence, and at Baylor Scott & White, 95% of our eligible facilities are designated or officially on the journey to designation from a status with magnet or pathways to excellence. Our nurses have access to tuition reimbursement, nursing scholarships, paid time off, so that they can continue to advance their professional skills. That's just been really critical for us, that we differentiate how nurses gain experience as well in the variety of specialties that they have exposure to and in acuity level as they advance their careers through the formal education and training.
Okay, great. So that's a robust set. So you're doing cross training when nurses want to cross train to other specialties.
Yes.
There's leadership training for those that want to, move up the career ladder. I know you have the robust new grad training programs as well.
That's right.
And there's opportunity for nursing to participate in research as well.
That's right.
Okay. And again, this career training, can you help comment on what's the role of HR and the role of nursing when it comes to career development of nursing at Baylor Scott and White?
Absolutely. Most of our nurse-specific training is led by nursing. So we have an amazing team of nurse educators focused on advancing nurse education and running the institute for us.
Great. And then what role has this played on, for your team in terms of attracting the talent or being able to successfully hire?
Oh my goodness. I have to tell you, as a recruiter myself and listening to our teams on the phone, this is a real differentiator for our organization. And it shows an intentional investment in the career advancement of nursing. And the program is so robust, it gets a lot of interest, and it's even featured on our career website. So it's one of the first things that nurse candidates coming to visit and learn about our opportunities can check out with us.
Okay, great. Right, yeah, the questions are coming in. So thanks everyone from the audience for continuing to submit those. All right, let's go on to the next topic of hiring and of compensation and benefits. And this has been a very difficult topic, especially over the last 12 months, because these numbers keep moving up, right? So, and we're seeing dramatic changes in salary numbers and benefit packages and so on over the last 18 months. Mm-hmm. So, how are you thinking about nurse compensation, given what's going on in the market right now?
Yeah, we have to. So the same amazing relationship we have between nursing and talent acquisition, we have with nursing and compensation here. We really benefit from that partnership. We're constantly monitoring what's happening in the market. But wage inflation is a real thing for us. We have looked at our benefits around self-care, childcare, everything you can imagine to honor our caregivers as people. We have incentive programs for new nurses. They're rewarded with base pay increases every 6 months until they complete their residency and graduate into an RN role. And then once they're in an RN role, our nurses receive annual increases along with performance-based bonuses. In these times, we've deployed retention bonuses. We leverage sign-on bonuses for new hire. We have COVID incentive programs and everything you can imagine to differentiate our total incentive package as much as we can.
Okay, got it. A couple of questions that have come through that these are quick questions. So are Baylor Scott and White RNs unionized? I think the answer to that's no. Is that right?
No, we're not.
You're not. Okay. And then there's questions just around how you think about retention bonuses versus sign-on bonuses. There's a classic, feeling of unfairness for the nurses that are already there that, hey, how come the new hires got a sign-on bonus and I didn't? It sounds like you might be countering that with retention bonuses, but curious how you think about those two types of bonuses.
Yeah. Well, and I would say we've got a third incentive that we've put in place as well. So it is pretty balanced. We have sign-on bonuses for high value skills, certain specialties. It's, the dollar amounts vary. I saw that question pop up. We list them right in our job postings. We're very transparent about the sign-on bonus opportunity. For our employees, we've deployed the same thing. Retention bonuses. We've done a company-wide $500 thank you bonus for all employees. We also have expanded our employee referral program, just looking for any additional ways to put some meaningful cash in the pockets of our employees as they help us achieve our mission of filling the roles. So it's been an effective approach across the board of additional incentives, but it's balanced for sure. And we know we're giving a lot of transparency to our employees on what the sign-on bonuses are, and our nurse leaders are very well prepared to have that conversation with staff and look at the incentives we have.
Okay, got it. Before we move on to the next topic, wanted to go back for a moment just to the career opportunities topic, because there's quite a few questions coming in around that one.
Sure.
One question came in from Tammy Garcia about these growth programs and these career programs for your internal nurses. Is it, do you cohort the internal nurses differently? Is it, or are they just included in the career advancement programs?
Boy, that's a good question. I don't have the answer to that.
That's okay.
I wish Cindy were here.
No problem. We'll follow up with you, Tammy. There is anyone can submit questions to questions@incrediblehealth.com anytime, and we'll also get back to you with answers too. And then has a training or career advancement programs changed at all or been affected by COVID at all? This is a question that came in from Kathy Hennessy.
We have not changed our training programs. We launched the Nursing Institute, Kathy, in July of this year. So the development of the Institute was in motion throughout the pandemic year.
Okay, great. All right, the next topic we wanted to cover together is shift availability and preferences, and just the general topic of flexibility for permanent nurses. Another top reason we see nurses changing jobs that we can see in our platform and our marketplace is because they want a different schedule, either a different shift or just frankly more flexibility in shifts. Now, what we're seeing in our data is the days of employers being very strict, like 3 days a week, 12-hour shifts, and that's it. That's the only option you have. I mean, those days are behind us now. And the employers that are adding more flexibility, either adding more part-time options or adding more, different shift options, are ahead of the game when it comes to attracting nurses, because this is a top area that nurses care about a lot. Mm-hmm. So how is Baylor Scott & White addressing these shift preferences and the desire for more flexibility from your permanent nurses?
Yeah, thank you for that question. It is a topic that is on our mind and something that we're constantly considering, exploring new options. But we have a lot that's been done. Our staff really leveraged agency and travelers during the surge, and looking at every way we could be more flexible. And so we've allowed some of our employees to move to a more flexible PRN status. We've increased the number of part-time positions. We've increased the size of our float pool just to create that opportunity for folks who need more flexibility. We also have spent a lot of time, Emon, on addressing our nurses as whole human beings. This is just a time for recognizing the human needs of our workforce. So we've got programs on the physical, emotional, financial, professional, social, and health being of our workforce. In order to do that, we've given all of our employees access to the Headspace app and a free membership so that they can work on mindfulness and meditation. We have free behavioral health e-visits with licensed social workers for our employees. And we've implemented a lot of things around self-care to help our employees take breaks when they need them and vocalize that in a way that their managers can support them and allow them to take those breaks. Also, You may not know, we're a faith-based health system, and so pastoral care has been, critical to the spiritual care of our employees, and our chaplains are rounding with our bedside staff continuously to ensure that their needs are being met. And then leadership rounding is more important than ever. It is really crucial, particularly where the call is for more flexibility, that our leaders are present and listening to our staff, and understanding what their needs are so that we can have the right programs and options in place for them.
Got it. So there's a few questions coming in about your reward staffing initiative and team.
Yeah.
I know that that's been an initiative that your team has been working very intensely to staff over the last 18, 24 months. This is the equivalent of a float pool. Would you like a float team in some ways?
We have in some ways. It's our internal. I'm not going to do it justice. It's our internal travelers almost, and so we have a great group that does that work. And then in other places, I've seen some of the questions coming in around float pool. How we're doing that is, we're hiring talent in and placing it where it's needed, and really streamlining the number of hiring managers involved in our selection processes so we can maximize as many great nurses into our workforce as possible.
Yep. So we work with over 500 hospitals and health systems, hospitals across the country now. And your team was actually one of the first to implement this reward staffing initiative, which is effectively your internal travel agency. And so just explain that to some of a little bit more to the audience that we know Baylor Scott and White implemented it, as well as a few other teams have subsequently done it as well. First of all, it's a way to counter external travel agencies, okay? Because essentially what you're doing is you are providing more pay to these nurses in exchange for their flexibility. And their flexibility might mean, hey, you might need to work in a whole range of locations, you might, or a whole range of units, but in exchange, you're getting, an increase in pay.
That's right.
Which is pretty similar to the value proposition that a travel agency gives them as well. And the reason that it's a very powerful strategy is it ends up being more affordable for a health system. At the end of the day, you're not paying the additional administrative fees to a travel agency. And these are, at the end of the day, your employees still. They are your W-2 employees.
That's right.
And so I know that's been very effective at your health system and a few others that have tried it, but we often get the question, what am I supposed to do about these travel agencies that are stealing my nurses? It's one of the answers is, just set up your own internal travel agency. Okay, great. And all right, so let's dive into the hiring process itself and the hiring tactics that your team and other teams are using. So I'd love to do a quick exercise with those of you with the audience. This is actually data from our LA market. It would be very similar in the Dallas and Fort Worth market too. But essentially, so what we're seeing here is we have three different competitors represented on the slide. We have one team that has the highest salaries in this local market. We have team B here that has the biggest brand in the market. They might be an academic medical center, or they have one of these national global type brands. Competitor C, though, or team C has the fastest speed of hiring. And you can see the number of days that candidates are spending in each step of the process that's being tracked on the Incredible Health Marketplace. And so the question to the group is, it which team hires more in a given month or in a given week even? What is it? Competitor A, the team with the highest salaries, B, the team with the biggest brand, or is it C, the team with the fastest speed? Feel free to enter your answers in the chat, A, B, or C. Okay, got a lot of answers come through. The correct answer is C. It is the team with the fastest speed. This is the team that's represented here does not have the highest salaries in the market. They do not have the biggest brand, but their operational processes internally are very, very fast, and they're able to complete recruiter phone screens quickly. They're able to complete hiring manager interviews quickly and get offers out quickly as well. This was frankly a surprise to us as founders. When we were starting Incredible Health, we had always assumed that, oh, it's going to be the teams with the biggest salaries and the biggest brands that hire the most. And it turns out that is not at all the case. And we see this in every single market that we work with, whether it's LA or Dallas or San Francisco or Philadelphia, New York, so on. It is the team with the fastest speed that ends up hiring the most. And so what the other data we have from our platform is 68% of nurses accept the very first offer they receive. And 61% of nurses accept their very first offer, even when the second or third offer that they get has higher compensation. So this is speed is something that nurses strongly desire, and it dramatically impacts their candidate experience. So Lisa, we know that you've done quite a lot of work on hiring speed. And so would love to kind of hear your perspective on how your hiring processes have adapted in the last 18 months.
Well, gosh, when we first met you, you had us thinking right away, thankfully pre-pandemic, about speed in our process. And so these numbers, I have to tell you, are quoted across our system by our nurse leaders, and they are really locked into the importance of going fast. I mentioned earlier that we have really implemented a rapid hire model for our locations, for all locations for nurse hiring. And it's even expanded into other areas where we hire, including allied roles, even customer service roles. We've been picking up some of the best practices set out by this team. What that looks like is, probably pre-pandemic, I would tell you, we would do multiple rounds of interviews, have candidates come back. There's a lot of coordination back and forth on schedules. And today we try to do it all in one sitting. Some of the things that I would think are extraordinary that our nurse leaders are doing is they are going out on the floor, backfilling the peer interview team, so that we don't have to work around scheduling challenges, that we can have our nurse leader talk to a candidate, have the peers talk to the candidate, and make a decision that day to get an offer out the door. And so that's the type of thing that we've been doing in that rapid hire model. We've also been exploring blitzing, or interviewing as many candidates as we can in a day, based on the candidate availability and, of course, our interview team ability, so that we can fill as many positions as we can, and as quickly as a window as we can. We're constantly balancing that with where the candidates are in their selection process. So to your point, the first offer out is a really important position for us. And I'm happy to go into how we're using technology or anything else that.
Yeah, absolutely. So definitely. So this is one slide that we created with the Baylor Scott and White team, and it's really it's sort of the next phase of talent acquisition and where it's going. And essentially, these are the 8 steps in the hiring process. We have the sourcing, the screening, confirming the candidate's actively looking, getting that first phone screen scheduled, ideally automatically scheduled, and getting the hiring manager interviews completed, sending offers, and getting these offers accepted. And so we've been working with the Baylor Scott and White team for almost 2 years now. And, Incredible Health is taking care of some of the first steps in this process, right? The sourcing piece, the screening piece, even getting that first recruiter phone screen scheduled, because frankly, these first 4 steps can be heavily augmented with technology. And when we're working with different talent acquisition leaders and nursing leaders, they acknowledge that, first of all, their headcounts aren't growing that rapidly. You can't keep growing your talent acquisition team exponentially to keep up with the market demand. And And then recruiters at the end of the day need to operate at the top of their license. In the same way we talk about, nurses have to operate at the top of their license, even recruiters and HR professionals need to do the same. And what does it mean to be at the top of your license if you're a recruiter? It means you're spending the majority of your time engaging and speaking with candidates and forming strong relationships with your hiring managers. And so therefore, if that's what we want our recruiters to do, that means some of this more administrative work, like sourcing and screening, frankly, should be handled with technology. And so Baylor Scott & White has adopted this model, and increasingly so. And it helps free up recruiter time so they can do what they do best. Ultimately, this also leads to dramatic cost savings, not just for the HR team, but for the nursing team, because when you're able to hire faster, you're saving millions, frankly, in travel nurse costs, overtime costs, and so on. So would love to hear your perspective, Lisa, on the use of analytics and technology in talent acquisition.
Yeah, absolutely. This has been a hurdle for us. We really have a system that will measure all of the things, but we've had to take a hard look at that candidate experience and recruiter productivity, to your point. One of the challenges that we've faced is transparency for our nurse leaders. And I don't know that we've got that exactly nailed, but we're working on it. We use Taleo as our applicant tracking system and Phenom People as our CRM, our website platform, and we host our application there. And that's really allowed us to move from a 20-minute application process to about a 5 to 7 minute application, depending on whether you've got an application filled out with us before. And that gives us more data, of course, about traffic, the sources and numbers of applicants that we have. But what's been really great for us is some interview scheduling technology. I can't even tell you how that's advanced for us. And we're very close to implementing from Phenom some screening and scheduling technology for that recruiter phone screen. So candidates can answer pre-screening questions with a chatbot and automatically move to scheduled with the recruiter. And that makes a lot of sense where the talent pools aren't really huge. So we're really grateful for our opportunity to leverage technology in every different way that we can think of that allows us to move faster. And we're building new dashboards that give a lot more transparency. As I said, that's one of the opportunities we've been facing is showing how many candidates we have in process, where they're at in process, and how long they've been there. And we're definitely grateful for our partnership too. Incredible help. Like I said, you've taught us how to be more efficient with our resources and time to win that war for talent.
Yeah, of course. We love working with your team. Your team was one of our early adopters in Texas back in 2019, and since then we've expanded dramatically in Texas and to other states as well. Would you mind just sharing, because we know you're getting asked even behind the scenes, what is it that drove your decision to use Incredible Health, and kind of how did you think about fitting it into your overall talent acquisition strategy?
Well, I thank you for that. It was a really easy decision for us. We first learned about Incredible Health from I think, a speaking engagement that you had on, and invited you in to share what you were able to bring forward for us here in Texas. We look at every opportunity to have access to a really high quality candidate pool in a very competitive market, particularly for certain specialties. And what we really appreciated is your innovative way to ensuring that these nurses met our very high standards, that you would accelerate our timeline and really showcase for us best practices on how to acquire nurse talent. So it was a no-brainer for us to sign up, and really an easy decision. And then, of course, you used our partnership to fill nurse positions at all levels, including director roles. And so we've been really grateful for the investment in our partnership and how that's paid off for the organization.
All right, fantastic. Thank you. Thank you, Lisa. Want to just give a quick overview of what it is that we do, and then we'll go into Q&A. So Incredible Health, it's used by hospitals. They use our custom matching technology to hire high quality permanent nurses at scale. And it's done in, we guarantee less than 30 days. I believe the average at Baylor Scott and White when they're using our platform is at, I believe it's at 23 days, something like that. Our platform average right now is at 20 days. And that just yields dramatic cost savings and not needing to hire travelers and keeping units well staffed to prevent retention as well. In terms of what we do, there's a few unique things about us. Number one, the employers apply to the talent instead of the other way around. As you can imagine, the nurses absolutely love that because, an OR nurse, an ICU nurse, they create a profile on Incredible Health. They sit back and relax. They hear from Baylor Scott and White, as well as, maybe a few others in the market as well. And the nurse gets to choose which interviews to accept or decline. In addition, we have a proprietary screening algorithms that we have built that automatically screens and pre-vets the talent. So we are serving up high quality talent to the Baylor Scott and White team and other teams as well. And then our claim to fame is our custom matching algorithms. When a recruiter or a sourcer at Baylor Scott and White is using our platform, it is actually very important when they log in that they do not see 200 nurses. They need to see 11, or that are the exact right fit for Baylor Scott and White's needs at that time, in the specialties that they're looking for, with the certifications they need, in the locations that they need as well. And so that is a key piece to really dramatically accelerating the process as well. And then, as Lisa mentioned, we provide very detailed data analytics, so we're able to track how many days candidates are spending in each step of the process, as well as advising on potential process changes to accelerate that hiring too. These are the kind of results that we replicate for the Baylor Scott and White team and others. This is a quick case study. So for this team, we got it down from the days to fill went down from 66 days down to 19. Where we have the most dramatic impact is on time to source, because that's often the hard thing when you're trying to hire specialized nurses or experienced nurses. And then, yes, we do shave off days later in the process too, through things like automatic interview scheduling. We're now used by over 500 hospitals across the country, including very big ones like HCA Healthcare and Providence St. Joseph and Baylor Scott and White, also academic medical centers like Johns Hopkins and Stanford and Cedars-Sinai, and lots of community hospitals too. I just saw the question, do we work with Unionized? Yeah, we work with many of our California and New York teams that we work with do have unions. And so, yes, we work with unions and non-union, magnet and non-magnet, and community, non-community, and every iteration basically at this point. All right, so let's dive into the Q&A. So one question was, can you dive into the rapid hiring model? I think you did cover how you do that one in detail. For the career training programs, a question that came up from Michael Loomis is, if you know the answer, how do you identify and develop top talent, or like your future stars in nursing?
Yeah, I'm not as close to that process, but I've certainly had transparency to the succession management portion of our process as I lead talent, including succession management here. And it's just a very thoughtful approach based on performance, career interests, and the alignment with those key competencies and attributes that we expect from our leaders and employees across the organization. So I'm probably not the best to talk about the nominations for the programs, but I know that there's a lot of leader-led and leader-nominated.
Got it. All right. Question from Alan is, how do you think about motivating your talent acquisition team?
Thank you, Alan. Good to see you. We've spent a lot of time focused on our team. They have the same excessive opportunities coming through this pandemic as all other positions. And we know that the work of our recruiters is incredibly important to the success of our health system. And so we've looked at not just how we improve the process for them. We've layered in coordinator roles to remove some of the administrative tasks where we haven't been able to move the needle as much with our technical platform as we'd like. We also implemented an incentive program for our recruiters that's aligned with our organizational goals around reducing vacancy. And so our recruiters are incented based on the number of hires they get. And it's a monthly incentive, so it's very timely for them. But mostly it comes down to just a ton of gratitude and recognition for the contributions that they make to the system. And they're recognized openly by our nursing leadership, as well as our broad leadership for the contributions that they make.
Great. Are there any best practices that you have implemented when it comes to the interviewing piece in particular? It sounds like you've shared a few earlier. You mentioned having backup interviewers.
Yeah.
You mentioned getting all the interviews done in a single day. Just anything else in terms of just the interview piece specifically around how you're driving speed there?
Yeah, I would say the only thing that I probably didn't mention is we have, well, there's probably two things. One is, a standard interview guides. We focus those discussions on the things that allow us to make a great hiring decision. And then secondly, we plan debriefs with our nurse leaders so that we can rapidly make decisions on who we need to get offers to as quickly as possible. So we don't want to have any lags in there. We make sure we've got that designated calendar time to connect, debrief on the interview so we can get an offer in motion really quickly.
Okay, got it. Another question came in. Thank you, Amanda. That was your question. So question from Chris. How have you thought about structuring your talent acquisition team to handle all this additional work, frankly, because the vacancy rates the vacancies keep increasing.
Yeah.
The amount of hiring keeps increasing. Just how are you thinking about structuring your team? And then it sounds like there's some use of technology as well. Just curious how you think about that.
Yeah, we actually went through an exercise of breaking down every component in our process. Literally every single component, from when a requisition's approved and shows up in our applicant tracking system to how it gets posted and how offers are created, every single step in the process. And we went through and said, when you look at these highly skilled recruiters, where is it most critical that they do the work? And that they're the ones, when do they need to have those connections with the candidates and with the hiring managers? And those are the highest value points that a recruiter has to be involved in. And we took everything else and we started to layer in additional resources, because you're absolutely right. Our volumes exceed the capacity of the team. We added a team of coordinators. It's a pretty sizable team that picks up a lot of that administrative work. Any place where we have a backlog of candidates that we can't get to, we're literally leveraging nurses to help us screen candidates, to help us get through any place that might be a bottleneck in our process. And likewise, we're using the technology to trigger those things. So we've been assessing and analyzing our process in every way in order to position our recruiters to do the work that really matters and the work that they love to do, and get that administrative stuff done elsewhere.
Got it. Another question that came up about your talent acquisition team is, how do you think about their backgrounds? Are they nurses by background? Are they recruiters by background?
That's a good question. It's both, actually. Yeah. So we have, most of them have recruitment as a background. I know some of them are on today, for sure. I've seen them in the audience. And so I would say generally they follow a career path. However, we really have opened our door to that nursing population. And we have a new recruiting manager that's joining our team from a nurse manager role. And so we're very excited about that functional expertise and bringing that into our selection team.
Got it. Just quickly answering Samika's question. Yeah, we will be sending out this recording. This is getting recorded and will be shared with the attendees. All right, and then this is a question. It's either for you or for Cindy afterwards, around using LPNs in place of RNs in some of your units.
Sure.
Curious how you think about the different levels of nursing expertise.
Yeah, we are absolutely hiring LVNs in our organization. They're LVNs here, and looking at every way that we can expand the staffing footprint of our nursing organization.
Okay, fantastic. Any other questions we want to make sure we tackle? Please feel free to keep submitting them. Okay. And then this question did come in. What technology do you see as which technologies do you see as having some of the biggest impact in freeing up recruiter time, so they're more focused and more strategic?
Yeah, there's a part of me that says it's in freeing up time. I think the interview scheduling is amazing. Advancement for us, and
isn't it so crazy how interview scheduling alone can turn into such a big bottleneck and time sink?
That's right. Yeah, for both parties, for candidates, for recruiters, for hiring managers, it's just remarkable what that's done for us. We still leverage digital interviewing, and that's been really great for virtual. We've been trying to work with candidates who aren't necessarily in the markets where we sit today, and make that an easy experience for them. And then, what I'm most excited about is our recruiters can be even more consultative. I think some of our technology today can show, here's our job posting. We can see how many people viewed the posting. Where did they come from? Did they click and apply to fill out the application? Did they complete it? And what that allows our recruiters to do is be even more consultative with their managers. Maybe we should look at the title. Maybe we should look at the content of the posting. Maybe we should think about where it's being posted. Are we, everything we can do to have an advantage in getting applicants today is really important to us.
Okay, and then we've been through. This has been a really intense time for hiring and retention of nurses over the last 18 months. Do you see some of the changes you made during COVID being permanent changes? Like you're not going back. For example, the online interviewing happening not in person.
Yeah. I think absolutely. One of the things we've been really great at is just pausing and reflecting. So we're piloting anything, any leader, any recruiter, any nurse who has an idea about what we could do differently, let's try it. And so what I love about this organization is we really reflect on lessons learned. Would we make this a best practice? How do we want to try this in other places? And so I would say absolutely yes. I don't think that this market is likely to change. I think, Iman, you started by sharing that we knew there was a nursing shortage going into this pandemic, and certainly expect that to be the case. And so we want to make sure that we're still fast, nimble, and really focused on what matters to the candidates, so we can get more than our share for sure.
Okay, sounds good. Thank you so much for your time, Lisa. Really appreciate it. For the audience, please feel free to send more questions. We just put the email up right now, questions@incrediblehealth.com, and we'll have Lisa or Cindy be able to send back answers to you. And for those of you who did attend, you know how to get in touch with our team, and feel free to reply to any of the emails that you receive from Incredible Health related to this webinar. And Lisa, thank you again for your time and sharing your strategies and your tactics with all of us.
Thank you. I really enjoyed the discussion.